All right, guys. So we're looking at clots during period. What's really happening? Why? Why does this happen? That is the discussion tonight. So please don't forget, tap on your screen, share the live. That's the most important thing right now. And invite all the women you know, because this is where they should be, right? All right, so let's get into the gist. Now, for some people, you will notice this in your flow, right? Not just blood, but dark, thick clots, right? Am I talking about you? Right about you. Okay, we have a flash goal. Let's clear this flash goal and we'll move on with our gist. Flash goal of roses. 12 roses. All right. 12 roses and we are done. Let's go back to the gist. Thank you, Queen Vicky. I appreciate you. Right. So, I was saying, right? You notice this in your flow, right? Thank you, Mary J. You are not just seeing blood, you are seeing dark, thick clots, right? Sometimes small, sometimes large enough to make you pause and wonder, hi, what is happening to me? Is this normal or is something wrong? That's the right way to think anyway. It's the right way to think. For some people, you'll be told, don't worry about it, it happens. Yeah. But that kind of answer is not complete. Reason why we're talking about it today. Right? That kind of answer is not complete. Right? So, let's look at this properly. Is that okay? Let's look at it properly. Tonight, we're going to open up the process. Right? We'll trace your flow, understand where the clot is coming from, and when they matter. All this and more we'll talk about tonight. If you're ready, talk to me in the comment section. Type ready. Then we'll gear up to begin our discussion. Don't forget, tapping on your screen is the most important currency in this place. Right? Tap on your screen. Talk to me. But again, I'll try not to make it complex. There will be no too much grammar, such that even a 5-year-old can understand. You understand? Because it's important you know it's your body. And a lot of times, because you don't know, you end up wasting time, money, and energy for what may not necessarily need too much stress. But we'll open the deal tonight and see. Thank you for the follow, Chief Babatunde. We'll open the story tonight and make sure that everybody understands. And if at any point you don't understand anything, call my attention. That is if you are following me. If you're not following me, leave me alone. Just a quick reminder, if you're trying to conceive, make sure you go and download the Preconception Blueprint. This book, download it from my bio. There's a link there. Tap on it. Download it. Go and learn how to prepare to conceive. You're wasting your time for many years now. It has not worked. Now you have something that can direct you. So go and do it. All right, let's begin the first part of the gist. The first part of the gist. When you see your period, yeah, what is it really doing? Right? You see this period that God put there. Why is it there? What is it really doing? Right? First and most important thing I want you to understand is that a period is not just bleeding. Can we rehearse that like nursery rhymes? A period is not just bleeding. What did I say? A period is not just bleeding. Thank you. Una go school. Right? A period is not just bleeding. You right? Period is a controlled shedding process. You right? And this happens each cycle, month by month. Right? Each cycle that happens. So basically, the simple way to understand the process. Each cycle, what you have is the uterine lining, that is your uterus, the inside lining, will build up due to the influence of hormones that we've talked about. So if you missed any of my gist from past episode, go to my YouTube channel, Dr. Godwin EMB. Go and watch those videos, especially if you are trying to conceive, whether you're a man or woman. In fact, there are 30 videos there for men alone, and I've taught men how to produce precious sperm. The sharpshooters, you will never miss road. Just go there knock waiting no good. You go carry. Anyway, just go to the YouTube channel, Dr. Godwin EMB. It will help you. All right, so where was I? So for each cycle, the uterine lining will build up, right? That's the first thing that happens. Blood vessels will develop within the same build-up for obvious reasons, right? Now, if for some reason pregnancy does not occur, if pregnancy does not occur, that whole lining that is built up breaks down and it is shed. That is what you see as menstrual bleeding, what you call period, right? That means menstrual flow contains blood, contains tissue fragments and mucus. I'll repeat it. Because it's going to answer the question of many people tonight. So, menstrual flow contains what? Blood, tissue fragments, and mucus. Time and again, I've had women say, "Oh, doctor, I saw my menstruation and I saw something like mucus, thick mucus." Or you can even snap it and send it. Can you see this thing? Right? Person, I don't see something safe. Don't be small. I will answer your questions when we are done with the gist. So just sit back, learn, and then we'll have enough time for Q&A. Is that okay? Boldly black. That's you. So what did I say? Menstrual flow contains blood, tissue fragments, and mucus. Follow me, because you're going to understand a lot of things. And some of the questions you used to ask, you will not ask them anymore. Right? So, menstrual flow is not just pure liquid blood, like some people will think. So when you see your menses, blood. It's not just blood. It's blood, tissue fragments, and mucus. Did anybody understand anything up until this point? Talk to me in the comment section. Type understand in the comment section. Everybody understand in the comment section. Let me be sure I'm carrying you along. Because if you miss me, you come for consultation and you pay. Right? You will pay. Right? Now, having said that, if you understand that, then it means that we can move on to the next thing. And the next thing we should be answering is why blood doesn't usually clot during a period. Because when you see clot, you are worried. But the usual thing, it doesn't clot. So let's start from there. It is actually because under normal circumstances, under normal conditions, right, your body prevents menstrual blood from clotting excessively. You can see there's already a mechanism in your system that is preventing it from clotting. Understood? Good. Now, the way the body does that, there's something that is called anticoagulants. If you cannot remember the name, don't worry. Just know that there's something like that. Our flash goal is 12 roses. It's almost running out. 12 people drop a rose. 12 people drop a rose to clear that flash goal. Thank you for the follow. I'll follow you back. Boldly Black, relax. I'll get to you. Right? 1 rose, 12 people. Let's clear that flash goal before the time runs out. You have been crying. Stop crying. Here, there's no crying. There is merriment, enjoyment. Enjoyment and enough knacking. If you are not a knacker, you are not supposed to be here. All right, where was I? So, I said that your body has a system that prevents menstrual blood from clotting excessively. Right, and it does so through anticoagulant that is released in the uterus, right? So these anticoagulants, what they do is they break down the clots, right? They keep the flow relatively smooth. That is the normal thing. So ideally, menstrual flow should not clot. Comprehend? You understand up until this point? Do you understand? Type in the comment section, understand. Because we need to relate. I want to relate with you. By the time I'm done with you, you stop worrying about your menses. Comprehend? All right. Understand. So if what I just said is true, the new question is, where does the clots that you see, where does it come from? Who is ready for this gist? I'm not seeing the comments. Talk to me. Are you ready? Just type ready. If you're ready, talk to me in the comment section. Type ready. And please tap on your screen. It's very important. That's the most important currency here. Tap on your screen. Martha is here again. So these clots, where do they come from? Right? We know what the body does. So these clots, where do they come from? Let's talk about it. Thank you for the rose. I love you too much. Right? Now, what we said earlier is where the body is in a normal state. Thank you for the rose, Idara. When the body is in normal state, that is what is supposed to happen. You have a normal flow, smooth flow, right? Now, when that system, when that balance is disrupted, thank you, Idara. When that system or balance is disrupted, we begin to have the discussion. So let's break this thing down step by step so that we'll leave nobody confused. Are you ready? Step 1. Or, okay, let's take it step 1, step by step. Step 1. Step 1, let's look at it from here, right? If bleeding becomes heavy, if bleeding becomes heavy, what happens is that the blood will exit the uterus faster than the anticoagulant can act on it. Right? Heavy bleeding equals to fast moving, and the anticoagulant needs time to act on it to break down those clumps. Right? So the breakdown process is overwhelmed. Then it comes out as clumps and you're now confused. Right? So the blood looks thickened. It forms clots. before it leaves the body. And this is one of the most common cause. Not necessarily because something is wrong with you, but just that heavy bleeding does not give enough time for the anticoagulants to act. That is the first thing. The second thing is there are some people that have a thicker endometrial lining, right? I'm all right. Queen Love, good to see you. You're welcome. Right? Sometimes you have thicker endometrial tissue. The endometrial lining itself may be thicker than usual. Yeah, may be thicker than usual. So what happens is it sheds in large fragments. I wish I could, on live stream, you cannot really share videos. I wish I could show you an animation that can give you an idea, but animate it in your head, right? So the uterine lining itself may be thicker than usual, right? Therefore, it sheds in large fragments. Remember, all that buildup was in expectation that implantation would take place. And what was the buildup? Blood, tissue, mucus. So when it's going to crumble and pour out, it's going to start tearing down. Then anticoagulants break it down and make it smooth. Is that okay? So sometimes you have a thicker endometrial lining that sheds in large fragments. So what appears as clot may actually include tissue pieces, normal tissue pieces that is combined with blood. So it makes them look darker, larger, and more noticeable. So, oh, you become apprehensive. Why am I saying clot? Ace is here. Hello, Ace. Good to see you. You're welcome. So you will become apprehensive. I have clots. I see clots in my menses. Why? I'm telling you why now. And that is the second thing, step 2. Thicker endometrial tissue. Adasa is here. Somebody's asking me, what are you talking about? I'm talking about clots during periods. That's what I'm talking about. So if that has been your experience, I'm telling you why. So I just talked about the second reason why, right? So let's look at the third thing, right? The third thing is there are some flow that are slower flow, right? So if you have a slower flow, it means that blood can actually pull as in P-O-O-L, that's pull, right? So when blood pools in the uterus or the vagina during exit, it has more time to clot because the flow is slow. Are you understanding anything? If you don't understand, don't worry. You come for consultation, you will pay. Right? So during exit, if the blood pools during exit, it has more time to clot, especially during heavy days or overnight, right? So you can have all that. So you may notice clot more in the morning or after sitting or lying down for some time, right? Am I talking about you? I know I'm talking about you. So these are the reasons why you can see clots. Is that okay? Now, what I just mentioned are normal reasons why there can be clots in your period, menstrual period, right? Now, let's look at when the clots are considered Okay, let me buttress the normal first, then I'll talk about when it becomes a problem. I think that will help your understanding. Is that Leon? Leon is here. If you are just joining, you're welcome. If you have not followed me, you want to follow me now, especially if you are trying to conceive. I need you to tap on your screen, share the live, so that other people can benefit from the information that we share. Right? And if you're trying to conceive, make sure you download this book, The Preconception Blueprint. Learn how to prepare your body for pregnancy. Right? Go to the link in my bio, go and download it, and start your journey to success. Because this year, everybody go carry belly. All right. Let's continue. So I said I was going to buttress. Yes, let me buttress when clots are normal, considered normal. Is that okay? Let me buttress that. Now, small clots can happen occasionally. Are you understand what I'm saying? Small clots can happen occasionally. When, I've said it before, during heavy flow days, after or rather at the start of menstruation, you can see clots, right? And these are usually small clots, infrequent, right? The size will be what they will consider to be less than a coin, if you know the size of a coin, right? Clots that are less than that size are considered normal clots, and they happen infrequent, not like they happen every time, right? And they are not associated with symptoms, severe symptoms, right? Remember yesterday we talked about those who have painful menstruation and the reason why they do, right? Yes, I did talk about painful menstruation yesterday. So if you missed that video, make sure you are hitting my YouTube channel. Go there and find out all this information. Dr. Godwin EMB is the name on YouTube. Go and find out. You'll be fine by the time you are done learning. Ma Rose said, I received triplets in Jesus' name. Amen to that. But make sure you are knocking waiting no good. Is that okay? Make sure you're knocking waiting no good. If you are trying to conceive and you are not knocking, I'm going to pass a verdict on you by the time I'm done on this live stream. Because I usually ban all those that don't knock from the live stream. All right, so where was I? Where was I? So I was saying that, right? These clots that are considered normal are actually infrequent. They are not associated with severe symptoms, and the size of the clots are usually small. Consider size of less than a coin, if you've ever seen a coin. Yeah, right? So that is what you consider to be a normal clot. So anything outside this, they will begin talking about it. Is that okay? So that's what I want to talk about when clots becomes a signal to you, because the body loves sending signals. The body loves sending notifications. If something is wrong, the body sends you a notification. So when these clots become a signal, when does it become a signal? Hampers, thank you very much for the roses. Right? Now, clots during menstruation deserves attention when they are large. When they are large, they deserve attention, right? And of course, what would you consider to be large? Anything larger than the size of a coin, right? It's bigger, right? So it deserves attention. When they are occurring every cycle When you have clots, you're experiencing clots in every cycle, it deserves an attention. It's time to talk to me, right? When they are associated with heavy bleeding, with heavy flow,
alright, so this now
clots,
goes straight into our discussion.
right?
We're going to talk about something that is almost never talked about.
Sorry about that. I think my studio is running a lot of campaign right now. Anyway, let's go back to the gist. So I said, when the clot is associated with heavy bleeding, it needs attention. All right. Also, when it's accompanied with severe pain. Remember yesterday when we were talking about painful menstruation, I gave you the conditions that can cause painful menstruation. So you want to add this knowledge to that knowledge and become well-rounded. Is that okay? So when this clot is accompanied by severe pain, oh boy, I can imagine what you're going through, right? For some people, it leads to fatigue and anemia. It deserves an attention. Sumi Love is here. Hello, Sumi Love. You're welcome. All right. So, at this point, clots as in CLOTS. Clots are not just variations. They are clues. They are giving you a clue. What is going on? What is happening? Talk to me if you are still here. Do you understand what all the things I've said tonight? If you understand, just type understand in the comment section. Type understand in the comment section. Let me be sure you are here. You are here and ready, right? All right. Oh boy, I'm thinking about you and what you will do with this knowledge. Your life will change. The things that you used to worry about, you worry no more, right? Right. So now a deep dive. Let's go deeper. Let's go deeper. Let's go deeper into what could be causing this clot that is causing you so much worry, so much trouble. Can I open up the common drivers of blood clots during periods? I will. Even if you don't say yes or no, I will. Because that's what I do. Who's ready? Talk to me. I want to be sure. Talk to me in the comment section. Type ready in the comment section. Good evening. Christy LaBelle is here. If you're ready, talk to me in the comment section. Type ready. Doc, you have not seen or you have seen your period. I don't know. In Chedo Phil. Is it that you did not see or you have seen? Thank you. I always look good, you know. That is the way you look when you are producing precious sperm. I've taught men how to do it. Let them go and learn. Let them leave me. Yes, I'm back. All right. So let's talk about what is causing these clots. What could be causing these clots? Hi, Mrs. Kamara. Mrs. Kamara is here. Hello, Mrs. Kamara. Right? So the number one cause I want to give attention to is hormonal imbalance. Remember, we already talked about what a normal clot would look like and what abnormal clot would look like, right? So the causes of the abnormal clot during period, number one is hormonal imbalance. Hormonal imbalance. Hi, Elizabeth Bouquet Boteng. I love that name. You're welcome. Hormonal imbalance. When you have estrogen, and progesterone not in balance, they are supposed to be in their right proportion. When they are not in the right proportion, right? Hi, doctor, long time. I was so busy doing my old girls. Oh, right. Okay, it's fine. I thought you went on the assignment of knocking with no good, but I trust you. You are good to go. Right. So when you have progesterone and estrogen not in their right proportion, in other words, they are not balanced, the uterine lining may grow excessively, right? That means more tissue will build up and more shedding will occur. Do you understand what I'm saying? So because of that, what you have is heavy flow and large clots because of hormonal imbalance. That is number one cause, right? Let's go to number two cause. Number two cause. Number two cause is uterine fibroid. Uterine fibroid. So if you have fibroid here and you are confused, it's time for you to hit my bio. Go to the link. Come for consultation. Let me help your life. Right? All right. Uterine fibroids. First of all, they are non-cancerous. Right? Fibroids are non-cancerous growths in the uterus. Right? But they can distort the uterine cavity, right? Because they grow, so they grow beyond their location. So they distort the uterine cavity. They can increase bleeding. Good evening, Kingsley. Nwaizi, you're welcome. Uterine fibroids can increase bleeding and even prevent smooth contraction. If you were here before, you already know what I told you about the uterus. The uterus is always in a constant state of gentle contraction, which will increase during your menses, right? If you didn't get that before, go to my YouTube channel. Go to my YouTube channel and get the old videos. You'll be glad you did. You'll be glad you did. So I was saying that, so these uterine fibroids, they can distort the cavity, increase bleeding, and even prevent smooth contractions. Hello. Right? And this will lead to heavy bleeding with clots. Just mute your mic. All right? So that is the second cause. That is second cause. The third cause is adenomyosis. We talked about it yesterday, but I'm going to repeat it for this reason, right? Adenomyosis, for those people who were not here yesterday, right, is a situation where the uterine lining grows within the muscle of the uterus. That's what adenomyosis is in a nutshell. So go to my videos in the profile. There is a video there on adenomyosis, right? You can even check it out on my story. I think there's a video on my story. Is that okay? So check it out. So this adenomyosis will cause thickened uterus. The uterus looks thickened, right? It feels painful, and you have heavy periods. And of course, you have large clots, right? Go and get evaluated. Anyway, I'll get there. So that's the number 3 cause. Where number 3? Yes. So number 4 cause of clots during period is endometrial overgrowth. Like I mentioned earlier, where the uterine lining can become thickened due to hormonal challenge. So when the lining becomes too thick for various reasons, including hormonal imbalance, you have more tissue that needs to be shed, right? So you have clots that becomes more noticeable, and you are apprehensive. So what's going on with me? Sometimes it's really not a problem. It's just that it is what it is, right? But in this case, it can be a problem because when you have endometrial overgrowth, is either is hyperplasia, or some hormonal imbalance is disturbing you. But you will get evaluated, don't worry. What number am I now? Don't forget. The next one is bleeding disorders, which is less common, but it's very important, right? Some individuals have clothing regulation issues, right? Remember, normally the uterus have anticoagulants that regulates the clotting of the blood that is coming out. That gives it that smooth flow. But some people have clotting regulation issues, right? The body cannot control the bleeding properly, so flow becomes heavier, and of course, clot formation will increase in such cases. Why would he be angry that you're on the live stream? I think you should get him to join the live stream, right? It's going to help. I can guarantee you that lots of couples are listening to us right now, and it's helping them, right? So for every couple that is listening to me right now, I grant you knocking waiting no good today and tomorrow. Knock waiting no good. You deserve it, right? All right, where was I? Now, having said all that, remember that clothes themselves, right? Clothes themselves are not the direct problem. That you see clots during your menstruation is actually not the direct problem, right? But the most important thing, what is causing them can affect fertility. Is that okay? For example, fibroids, right? Fibroid can interfere with implantation. Remember, it largely is depending on the size and the location. So if fibroid is in the location where implantation is supposed to occur, it will affect it, right? If it's too large, it also will affect implantation. UD is here. You're welcome, UD. Right? Hormonal imbalance can disrupt ovulation. Right? There are those that have endometrial issues. Those endometrial issues, like when you have endometrial issues, it can actually affect how the uterus receives the fertilized egg, that is the embryo. It does, right? So the clot in itself is not a problem. The thing that is causing the clot may be the one affecting fertility. That's the long story I'm trying to say, right? And the reason why I'm trying to buttress this matter is because if you ignore it, it will mean that you are missing something that have a deeper issue. Don't ignore, right? The common mistake that people make is that people focus on, I have clots. Usually when they come to the clinic, they'll say, oh, doctor, I'm seeing clots. The clot is the problem to them, right? It's not wrong based on their knowledge, right? But I would think that the better question would be, why is my flow heavy enough to clot? That means you are really informed and you are ready for the real cause of the problem, right? Yudi, oh, you came late. Oh boy. Yudi, you came late. I talked about that. So to your answer, the answer is yes. Of course, there are small clots that is normal with menstruation, right? So calm down. It's not a problem. We already know what an abnormal clot is and what a normal clot is. Is that okay? So if you miss the details, don't worry. Go to my YouTube channel, Dr. Godwin EMB. Go and catch up on what you missed. Is that okay? There's so much information, you will never miss anything. Right? So this whole information is to help you begin to ask the right questions. Don't focus on the simpler things. Ask questions, important questions, like why is my blood so heavy that it can clot? Is heavy enough to clot, right? Because that's where the answer lies, and your doctor will do due diligence. And some of the things that should be done for you would include a pelvic ultrasound scan, right? What they will be doing is to evaluate the uterus and the surroundings for mass, whether fibroid is there, whether there's adenomyosis, whether there is endometriosis, whether there's anything abnormal that is not supposed to be there. Ultrasound is supposed to catch it and report it, right? They also would want to do hormonal assessments to answer the question why your menstruation is so heavy that it can clot, right? And of course, a full menstrual history will be taken so that we can have a clear understanding of what's going on with you. But first, you've got to present yourself before you can be helped, right? But at least you have a starting point from what we are talking about tonight. Then you can now approach your doctor and you work together. Is that okay? Because when you identify the cause, your approach will change. Is that okay? So clothes are not random. Clothes don't just happen, right? They are more like a mechanical outcome of the flow speed, right? That's one. The flow speed from what we talked about from the beginning. Tissue thickness, hormonal balance. So instead of you to be apprehensive, being afraid, oh my God, I'm seeing clots everywhere, right? And I love some of my patients are so wonderful. See clots and mucus, they are just confused. They'll just snap it. Dr. C, what is this? It's good. Such people will not die quick, right? They will not die quick because they want to know, they want to learn, right? Advice for what, Busi? I didn't see your question, right? So instead of you to be afraid, just know that clots is an information of how your cycle is functioning, right? What is good, Paul? Talk to me. I don't understand. So let me quickly start answering questions because these people, they're not going to let me rest for comment session. So if you are noticing clots, don't panic. Calm down, right? But don't ignore them either. Don't panic, but don't ignore them. Is that okay? I want you to pay attention to the size of the clot. Look at the frequency. Is it every cycle, right? And is it associated to any symptom, right? Severe pain and any other symptom that you can describe. These are the things you should be looking out for. Is that okay? Because the patterns tells a story, and your body is giving you a data information that something is wrong or something is okay. Is that okay? So please send your request to come up. While we're waiting for them to come up, understand that menstrual flow is meant to be controlled. You have PCOS? menstrual flow is meant to be controlled, coordinated, and it's supposed to be efficient, right? When clothes become too large or frequent, it's not just about you seeing clothes. No, it's not about it. It's sending this request. It's about what is happening inside you, right? And once you understand all these small things I've been talking about for months now, you stop guessing. You start investigating. And if you're trying to conceive, you have more than enough information. More than enough information right here and in my YouTube channel to begin your journey without doubt. Is that okay? All right, let's answer the questions of the people that are here. Lady G is here. So thank you very much for the heart me. We talked about clots during period. Send your request now. Let's answer you before we go.